And here's our arthritis condition on this slide, where the left picture to your left shows the normal hip and the right picture shows the cartilage eroded, which is an arthritic condition. And of course, when it gets bad enough, bone on bone, the potential for more severe symptoms exist. Here's a picture of a progressively worse arthritic condition of the knee. And the worse the arthritis is, as mentioned, the more painful and the more symptomatic the joint becomes. Arthritis affects many, millions of people. It's usually progressive over the course of years, over the course of time, in terms of the pain, the stiffness, the interference that it creates with normal everyday activities. Although there are many types of arthritis, the two biggest, broadest types are osteoarthritis, which is what most people have, regular old arthritis. The other is rheumatoid arthritis. Of course, one could have gouty arthritis or lupus arthritis or post-traumatic arthritis. If you've fractured your knee 10, 15 years ago, it can become arthritic. Each of them have their own considerations in terms of how it affects the joint and treatment considerations.